about polyps. Polyps are just basically growths inside the colon. There are different types of polyps. Some are pedunculated, meaning they have a stalk. Some are sessile, meaning they're kind of flat and raised. Some are just tiny, we call it diminutive polyps, and some are flat. But polyps are usually the reason why people get colonoscopies. A colonoscopy is a screening test, or in other words, a preventative test. We do colonoscopies at basically age-appropriate screening to prevent cancer. What we do is we look for polyps that could otherwise turn into cancer if left in the colon for a long time without intervention. What happens is the polyp basically grows in size over time, okay? And then what happens is it starts getting little cancer cells in it, and then if you leave it alone over time, the cancer cells move down into the mucosa, and unfortunately, they come outside of the colon wall, and move into lymph nodes, and then eventually metastasize to distant organs like the liver, the bone, and the brain. So the point of doing a colonoscopy is to catch these polyps before they have a chance to advance into cancer, or they can advance and move outside of the colon and go to distant sites called the metastasis. So I'm going to show you how we remove polyps. So a lot of patients ask me, well, when you see a polyp, how do you remove it? So I'm going to ask my assistant Zarina here to help me. Let's just say we have a diminutive polyp. It's very small. What we do is we use this tool here. It's a biopsy forceps. Zarina, go ahead and open it. Look at how tiny this thing is, right? So I'll show you on my hand. I'm going to have Zarina take a biopsy with my glove. Go ahead, Zarina. Go ahead. Okay. Open it again. Close. Awesome. Maybe it's not strong enough to get close. Okay, so pretty much that's it. I mean, it's not cutting through the glove very well, but it just basically hooks on to the polyp, and you can pull it off. It's very, very small, right? And it's basically for very tiny polyps in the colon. Another tool we use is called the snare, for snare polypectomy, meaning pretty much removing polyps that are bigger. And so open it. This tool is pretty cool, and it's used for bigger polyps, such as the ones that I showed you here with the stalk, pedunculated, because you can literally put this snare around the polyp and take it down to the neck and decapitate it. So I'll show you, for example, if this was a pedunculated polyp, we can put the snare around and close it, and we can actually literally burn the tissue and produce it. It basically can conduct electricity. We can burn it and cauterize it and remove it, okay? And that cuts the polyp in entirety. If you have very, very large polyps that are bigger than this, we have to remove them piecemeal. So imagine this is a very large polyp. We would go ahead and cut this part first and remove that, and then open it, move down here, close that, and open it again and close that. And so pretty much remove it piecemeal, okay? Open, okay. Now, if we run into a situation where we have a large cancer and this device is just not large enough to catch the entire polyp or cancer, and we think that we would be leaving residual tissue in, the best way to do it is to actually take these biopsy forceps and take biopsies of the polyp, send it to pathology, and basically put tattoo markings here in the colon from the proximal end to the distal end of the polyp or the cancer. And so when it comes back as cancer, the patient can go to surgery, and the surgeon can see exactly where the tattoo markings are. They cut that section, so they would see the tattoo markings from outside. They cut from here and test the lymph nodes to make sure that the cancer hasn't traveled to the lymph nodes. Okay, so that's how you do a colonoscopy. Or that's not how you do a colonoscopy, but that's how you do polypectomy when you're doing a colonoscopy. I hope that helps. If you have any questions, please go ahead and write them for me. Thank you.